Hello, my name is Haley Lefholtz. I'm going to be talking to you about maternal malnutrition. Are you pregnant or planning to become pregnant in the near future? Do you have a sister, daughter, or wife who is pregnant? Then this information is for you. Did you know that Bangladesh is among the countries with the highest prevalence for maternal malnutrition? That nearly a quarter of women who are of reproductive age are undernourished or underweight? That one half of nearly all women are anemic, meaning they don't have enough healthy blood. That calcium intake among women is extremely low. That causes potential for difficulties during pregnancy, such as eclampsia or preeclampsia. These are all complications that can cause serious harm to mother and baby, complications that can be prevented. Anemia. This is a picture of a normal amount of red blood cells, an anemic amount of red blood cells. You want the amount of blood cells on the left. That would be considered more of a healthier blood. That would be better for mom and baby. Every hour, 3 women die due to pregnancy or childbirth complications. Over 90% of women give birth at home at the hands of untrained attendants. National average age of women that are getting married is 15, with the first delivery at 18. They are at risk for these complications and conditions that could all be prevented. The major issue with this country is that many of them are young mothers who are uneducated. Many are already malnourished and don't know it. Many don't have access to good health care, in spite of having access to a health facility within 2 kilometers. Only a few percentage of women receive care from a skilled provider. And of these women, not many of them made more than 4 visits. Did you know that folic acid and iron supplements help with having healthier blood and prevent complications to mother and baby? Only a few percentage of women are taking the supplements that could be saving them from complications for both them and their babies. How this has an effect on them and their children? 30% of infants have a low birth weight. 1 in 5 babies are born stunted. This is one of the main factors contributing is the malnutrition. What does this mean? Your children may not be growing as much as they could be. No mother wants that for her or her children. Children of poor families in this area are not getting the nutrition they need. 41% of children under the age of 5 suffer from moderate to severe stunting. Look at this young boy smiling even though he is far too small for his age. It's time to make a change. You can do this. We can all help these women and their families. How to change? Go to prenatal appointments. Encourage your daughter, your sister, and your mother to go to the healthcare appointments that they need to have. Eat a healthy diet. Everyone benefits from eating a healthy diet. Take supplements as directed by your physician. Encourage your sister, your daughter, and your other family members to take the supplements that are ordered by their doctor. Prenatal clinics. According to the World Health Organization, there has been over 14 community clinics being created for every 6,000 population for across the country since 2009. That means there are more clinics being created, providing more care to more patients. But the important thing is that they make those appointments. Supplements. Iron with folic acid and zinc. Why is this important? because iron, folic acid, and zinc help with how many healthy blood you have, and how many red blood cells, and how much oxygen your blood carries. Nutrition. A healthy diet is important. Eat some good iron-based foods. Eat foods rich in vitamin C. Eat food from good sources that have folic acid. These are all fruits and vegetables and other various food groups that are good for you and will help you and your baby. Did you know, according to Dr. Edward, dark chocolate has wonderfully high iron content? Per ounce, dark chocolate has that higher iron density than steak. 100-gram bar of 70 to 80% cacao chocolate contains 12 milligrams of iron. Look at that chocolate. This has been sponsored by Haley H, Haley L, and then Sarah P. Here are our references. Thank you.